You're listening to What She Said on Canada Talks.
Welcome back. I'm Christine Bentley in studio with Kate Wheeler, and I'm not sure if you're aware of this, but it's Rosacea Awareness Month, and there are 2 million Canadians, and it's a staggering number of people affected by rosacea, and we have an expert with us, Kate.
Dr. Ben Barankin from the Toronto Dermatology Centre is here to talk about it. Now, you're a spokesman for there's a Rosacea Society, an awareness group, the Acne and Rosacea Society of Canada. So tell us a little bit about rosacea, because it's fairly common apparently.
It is indeed common. It's a chronic condition, typically affects adults 30 to 50 years of age, although other ages can be affected. Very common in certain ethnic groups, so particularly the Celtic population, the Northern Europeans as well. Both men and women are affected, but women more commonly. And there's often a family history of this condition, and patients typically have a variety of signs and symptoms, including redness, burst blood vessels, sensitive skin, easy flushing, pimples and pustules, and this can go on for years and years.
So how would it be different from eczema, let's say, or eczema? I never know. I mean, it's sort of tomato. I'm never sure how to pronounce it, but...
Sure. Eczema is another very common condition, and eczema is a little different. It doesn't have the pimples and pustules, so it doesn't have the acne-like features. People with eczema typically have itchy skin, dry, sensitive skin, worse in winter. Also can be hereditary, but quite different. And sometimes we need a dermatologist to help make the diagnosis, whether it's acne or rosacea or some other skin condition.
But I mean, I think one of the points is that many people don't know the symptoms, so are you saying that there are many people walking around with rosacea, some level of rosacea, and they're not aware of it?
Probably most people, actually, with rosacea are not aware that they have.
What do they think they have?
I think, many of them have had redness and easy flushing, sensitive skin for many years.
They just think they blush easily.
Exactly, and they were just told, that's your skin type, you're very fair. And in fact, a number of them have rosacea undiagnosed, and that can be an issue, not just cosmetically, but there are associations with rosacea, such as eye problems.
Really? What eye problems?
So about 50% of people with rosacea have or will develop eye involvement, and that can mean irritated, dry eyes, grittiness in the eyes, frequent styes, even things like conjunctivitis and rarely blindness.
Okay, the other thing that I was really stunned, and of course it makes sense when you think about it, are that there can be significant emotional effects, up to and including depression.
Absolutely.
Involved with rosacea. How does that connect?
In fact, with every skin condition, there's an elevated risk of mental health issues, and that's because, you wear your problem on your skin. Everyone can see it. You can't hide it. So, in fact, people with rosacea have 5 times the risk of depression of the regular population. It's a huge difference, and 75% of patients with rosacea report low self-esteem. So, you're walking around as an adult, and you still have acne. It's one thing as a teenager when you walk around with acne, and 85 to 90% of your cohort has acne. But as an adult, to be walking around with acne and persistent redness, it's quite bothersome. It's embarrassing. It can affect your workplace, your dating. It has a lot of impact.
So let's talk about the causes and the cures. So first, the causes. It's somewhat hereditary, but I mean, has it got anything to do with foods you eat, or sleep, or stress, or what would cause it or aggravate it?
Sure. So I think generally you have people that are predisposed genetically. Someone in their family had it. They come from a certain background.
Right.
Generally, they're going to be fair skinned, so Celtic or Northern European, as I said. And there are things that trigger it, that make it worse, that flare it. So hot and spicy foods, for example, really hot showers, alcohol, particularly red wine, stress, windburn.
If you say chocolate, I'm going to really start to cry.
Definitely not chocolate. We don't want you crying on air. And really anything that increases your core body temperature can aggravate it. So
why red
wine?
wine?
It causes you to flush more.
Right.
So it causes your blood vessels to dilate more.
Okay.
Okay, so then let me ask you, if flushing can do that, is there any connection to menopause? I mean, because one is personally experiencing lots of hot flushes these days, and I am from England, and I have very fair skin, but I don't have that redness. Actually, I'm sort of glad I have fair skin because I actually have vitiligo, so that doesn't show up as much as it would on somebody with darker skin. But you know, so how can you? Is there a correlation between that kind of core temperature change?
No, there isn't. So
That's a relief.
You know, there you can have menopausal flushing, and that can be totally separate from the flushing of rosacea.
So it's not hormonally linked?
It does not appear to be hormonally linked. There are a few patients that say that it does flare with their periods, but generally speaking, it's not considered.
Well, I'm just wondering, because you said it's primarily, most predominant, from the age of 30 to 50, and we hear that women, especially if they seem to be more affected than men, go through big hormonal changes, you know, sort of 30, 40, 50. So it's,
you know,
why that age then?
We're not sure why that age, and we do know, for example, that acne often has a hormonal element in women, and in some of those cases we can treat them with the oral contraceptive pill, and that can make a significant difference to their acne, whereas doing the same in a person with rosacea doesn't seem to have the same impact. So the hormonal influence is not as important as it is in acne.
So, Dr. Barankin, then what are there is no cure, as I understand it, but there are some treatments.
Indeed, there is no cure. There's certainly a lot of research going on in rosacea because it is such a common problem and very bothersome to a lot of people. There's a variety of treatment options. So historically, we've used various topical creams, such as topical metronidazole, which is a form of an antibiotic, and that can be very helpful, particularly for people with the pimples and pustules of rosacea. And it's important to clarify that there's really two main types of rosacea. There's the one that's similar to acne, where there's papules and pustules, and then there's another type where it's more redness that's persistent, burst blood vessels, and easy flushing. There are also, as I said, ocular rosacea or eye involvement rosacea, and sometimes you can even have swelling of your tissues, such as your nose, what we call rhinophyma, more commonly in men. Those are other rosacea variants. So back to the treatments, there's the topical antibiotics like metronidazole. We've used oral antibiotics as well, typically in the tetracycline family, and they work more in their anti-inflammatory aspect as opposed to their antibiotic effect.
But you're still taking them, so I'm worried about, you know, building up a resistance. We often hear about that, so...
Yeah, no, that's actually a very good point, and antibiotic resistance is becoming a really major issue. So typically we've treated people for 2 or 3 months to get things under control with their skin and go back to topical therapy. That said, there are newer oral agents that are more anti-inflammatory than antibiotics, so they're safer, what we call sub-antimicrobial antibiotics. There's a new gel that came out that really helps with that redness and flushing. We do a lot of laser work as well at our clinic and other physicians to treat that persistent redness, the burst blood vessels, the easy flushing. And there should be a new cream coming in the next 6 months or so, which seems to have terrific data, and that will have a huge impact on rosacea. So there's always new developments. We've had a couple new treatments in the last 2 years, and there's a couple more coming down the pipeline that look very impressive.
Well, that sounds amazing.
Now, there is a website where people can go to find out more information. Is that the...
Yes, that's right. So there's a website, rosaceahelp.ca, and that's information from the Acne and Rosacea Society of Canada, which was developed, all the content by dermatologists from across Canada. So the information is scientific and relevant and important, and it's for the Canadian public.
And hey, you're also on Facebook. Rosacea Help Facebook page.
Yes.
That makes things easy when you're cooling around page. So, I mean, it's important to know. I would assume that there are questions on this site to help you determine if what you have is, in fact, rosacea.
Absolutely. So, yeah, you can get guidance through the website to determine if you have rosacea, what type of rosacea, and what you can start doing as far as trigger avoidance and minimizing flare-ups, and who you should see and what sort of things you should do to manage your skin and prevent flare-ups.
Well, it's very encouraging to hear that we've had new treatments coming out in the last couple of years and another great one coming out in the next 6 months. So here we are. Thank you very much.
My pleasure. Thanks for having me.
Click the channel subscribe button for full-length interviews and more from What She Said here on YouTube.